It's really nice to come to a job every day where you see people getting better. And as a nurse, you don't always see that. I'm the director of nurses here, and we have close to 80 nurses that work every day with these patients. And some days it's not an easy job for them because patients, being patients, sometimes they're not as pleasant as one would like them to be. However, these nurses are wonderful to the patients. They do a fabulous job of assessing them in a 2-minute overview at the window while they're receiving their medication to make sure they're in good health, they're not sedated, there's not an issue, and they see the same patients day after day after day. They get to know them well, and they're a good support system for the patients, and the patients look for the same nurse often. If you know who you're talking to every day and you know about their issues, you know that their mother just went to the hospital, and you ask, how's mom today? It goes a long way to that patient feeling that somebody's caring about them. And since they see them regularly, they know all about them. And I think that really adds to their ability to say to the nurse, I have a problem. Can I talk to you about it? And they do, because they feel comfortable with someone they've seen for a long time. So I think the nurses have a fabulous job here as far as everyday interaction with these patients. Because if you're on methadone, you come in 6 days a week. I work in the primary care clinic, and the primary care clinic is open to anybody in the community who chooses to use us, but basically it was made available for our patients that are enrolled in the Abt Foundation, and they come here first after they've been evaluated. We do their physical for admission to methadone treatment. After that, they are offered service in our clinic, and they can come anytime. They can walk in if they've got a sore throat, or if they're not feeling well, or they have appointments for their diabetes, their hypertension, or whatever it may be. Patients come to us and they may not have seen a primary care doctor or any physician for many years. Part of that is their disease process. They were not willing to come in. They were busy doing other things. But really, when they do come into our treatment facility, because anybody is able to come in, they don't mind coming to us because we don't treat them in a way that makes them feel stigmatized. We accept that they have a opiate dependence diagnosis, and we treat them. I think about how much people have received the treatment they need so that their lives continue to be good, the health care they didn't get maybe before, that their diabetes is now in control, and maybe they won't have the side effects of diabetes because it wasn't in control, or their hepatitis C is treated. They're feeling good. People don't do well in drug treatment if they're not feeling well. And in order to feel well, you have to take care of yourself. And I think that's a big piece of this. They get medical care, they feel really good, so they can work hard at taking care of their substance use disorder. Everyone that works at the Abt Foundation has a mission to help people with opioid dependence. I don't think that you hear that too many places, but that is what we do. And I've been here 30 years. I will say that people are quite happy to be working here. People are very pleasant. I think they enjoy what they do. And it's, again, I think because we make a difference in people's lives, we give them their lives back.